I remember the first time that my husband and I came here. My husband had an appointment, and we had studied the appointment card, and we had it all figured out where we wanted to go. And we got here and got off the elevator and walked out into the Gonda building, and everything that was in our mind was gone. Okay, where do we go? So when we moved here and decided to volunteer here, we started volunteering, and it's amazing that you can see that look in the patient's eyes. And so you just walk up to them and say, is there anything I can do to help you?
When you put the blue coat on, it means something. It's one of the first people you see when you walk in the building and throughout the campus. It's something to be very proud of. I became a volunteer because as a past patient, I seen the benefits of a volunteer can make in somebody's life. And I thought when I got my health back on track that it would be a good way to give back.
I have been a volunteer for 30 years. I became a volunteer because I live in a community that I like. And my children have grown up here, and I have been in the workforce here, and I wanted to do something with my life to give back. So I thought this would be a good way to do it.
I think it's an amazing opportunity not only to benefit yourself, but benefit the community. You become knowledgeable of the clinic, you meet new people every day you're volunteering, and you make a tremendous difference in the lives of the patients.
When I looked at all of the volunteer services around Rochester, Mayo Clinic is the one that stood out the most to me. And I came in and I talked to Marie, and she was so wonderful with describing what we do here and the services that we provide to all of the patients and the visitors, and the goals and all the achievements that we've had so far. And it all just really amazed me, and I thought that I would love to be a part of something so great and something so promising, and something that provided people with a lot of hope and comfort when they come here to seek help.
I really enjoy being a volunteer and helping people out and the other volunteers themselves. I am so proud to be part of an organization the way they treat you and everybody else.
I think that healthcare is also about treating the person, and they are there and they might be sick physically, but I think they also need that mental, that emotional support. And I think that is something that the volunteers can really provide. I want people to walk out of here feeling better physically, but I also want them to be happy and feel like they were not alone during their time.
I tell people that we give to people when we come, we serve people, but we get so much more back. And I know people hear those words, but it is true. When you can help somebody, it just is, it is a blessing to you to be able to do this.
And I also think that it's important to think about the things that are greater than yourself, to think about the community in which you live, to think about the people that need your help, and you think about how much of a difference you can make by just doing all the small things, like volunteering at the Mayo Clinic. And it's taught me a lot about the value of life and the positivity and how much your attitude affects your outlook in life and how that actually affects you and the people around you.
To be the face of Mayo Clinic is very important. If we smile, Mayo smiles. I think it makes us a warmer place, a friendlier place, a more helpful place.
Thus far, I have been very impressed with how the Mayo Clinic treats their volunteers, and I feel really valued here, and I feel like I'm not just another volunteer. I feel like I'm a special individual that has been selected to become a part of such a great team of people. Every time I get home from volunteering, I've always been happy. It's like, I'm so glad I went today, and I'm so glad I met this person. I'm so glad that I was able to make him a cup of coffee when he couldn't.